Now that we've talked about several appliances, some well-known and been around for decades, and others newer, those appliances specifically were manufactured in an analog environment in the dental lab. So if you remember, there's two different workflows. There's the dental lab workflow, and there's your practice workflow. In the dental lab setting, the appliances we talked about in the last couple of videos are in an analog workflow made on stone models by a lab technician. The appliances we're going to talk about in this video are a 100% digital workflow. That means they go from the scans in your office to a dental lab that either mills or prints these particular appliances. Now, the first one that I want to show you is the Pantera Desaad appliance. This is the only appliance in the United States that is FDA cleared to treat apnea that is printed. So this particular appliance is a 3D printed appliance that is incredibly flexible. As you can see, the patients would have a very difficult time breaking this appliance. However, the appliance is made very specific to their digital scans. So it's important that we have high quality digital scans that are going to the lab for this appliance. If you notice, this appliance uses a suck down fit type of a feature. There are no ball clasps or material holding the teeth. It's just a suction fit appliance. The other important component of this appliance is that it has a telescopic hinge. Any appliance with a telescopic hinge like this needs to have solid retention on both the upper and lower teeth because the appliance itself is connected. So when you're doing these types of appliances, make sure that you have the right undercuts and tooth height to be able to maintain that type of retention. Additionally, with this type of an appliance, it's very minimal in bulk and very lightweight. This particular appliance is usually referenced as 1 grain or kernel of popcorn in weight. It's very, very lightweight. Some people may joke that this looks like the vampire teeth that come out around Halloween time. I can assure you there is a lot of technology and specific measurements that go into making this particular appliance. So we want to make sure as we're showing our patients this isn't some kid's toy. This is actually made for their specific tooth structure, custom printed, and it fits their mouth. That's a pretty incredible feat. Now, the way to adjust this particular appliance is to rotate it, take off these bars, and the appliance will come with several bars for a forward protrusive motion and retruding the mandible back. Now, ideally, you're going to have the patient set in their bite and their starting position, which is slightly protruded, and then move further forward from there. But these additional bars will give you the flexibility that you need when adjusting the appliance. The next type of appliances are CADCAM milled appliances. The one I'm holding in my hand here is the Prosomnus IA appliance. This appliance is an interlocking appliance with a fin technology. However, instead of a 30-degree dorsal fin type of a interlocking mechanism, you have a 90-degree fin, which when the patient opens and closes doesn't allow them to retrude at all. It maintains the bite position that you've identified that the patient should be in for treatment, which is ideal. In addition to that, this particular appliance has a lingual-less design, meaning there is no material on the lingual side of the teeth, both on the upper and the lower. This is unique to this particular manufacturer, and it comes in handy when you have a patient with a significant gag reflex or a very small mouth. Additionally, this appliance trades out trays in order to be adjusted. So in this particular setting, this is an upper 0 and a lower 1. These appliances would be together in a 1 millimeter protrusive position. So let's say you wanted to move the patient to a 2 millimeter position. Well, you would trade out the upper 0 for an upper 1, and together the upper 1 and lower 1 would equate to 2 millimeters of protrusion. This appliance has no moving parts. When you order this appliance from the lab, they will send you whatever series you purchase, anywhere from 4 to 8 trays on this particular appliance. So as you order it and you have multiple trays, know what your starting position is and know which ones you need to trade out in what position. This appliance is milled from a solid PMMA puck, which means it is extremely strong, it's rigid, and it is not porous and will not grow bacteria or stain over time. A very solid choice in a fully digital workflow. The last appliance we want to talk about is the OPTI Sleep. This particular appliance is also milled from a solid PMMA puck. It has an upper and a lower design that is uniquely cut for the patient's dentition. One of the concerns anytime you deliver an oral appliance is soft tissue impingement. If your appliance is pinching on the gum line and causing a sore, that's a problem that needs to be adjusted. This particular appliance has specific cuts for the patient's dentition to match their tooth structure. Additionally, this appliance has a telescopic hinge here. This hinge also has protrusive and retrusive movement. So not only can the patient move laterally in this structure with this appliance in, but they can also, in their envelope of function, as they open and close, move back and forward slightly. This is important because when you dictate the envelope of function, that means how they open and close in a protrusive position, some patients will feel claustrophobic. I mean, try it with me right now. I know we're talking about appliances here, but let's just try it. Go ahead and push your jaw forward, and then I want you to open and close like you normally would, but in that forward position. It feels really strange, right? Now imagine you're a patient who doesn't understand anything dental like you do, and you put an appliance in, and that appliance is forcing them to open and close in that position. You can imagine that that takes some adjustment. Now, it's not bad, but it takes them getting used to it. And the number one thing we're trying to achieve is patient compliance. So this particular appliance, having that feature, actually adds an additional level of flexibility that is beneficial for the patient. Last feature of this appliance, it is bruxism rated. So not only can the patient move side to side and protrusive and retrusive and open, this appliance will not break down or tear down if your patient has primary bruxism that isn't fixed by treating their apnea. So it's a solid choice in an all-digital workflow. Now, one thing that's important to note with this appliance, its sole output is from the Seacat software, meaning if you want to use this appliance and purchase it from Seacat Labs in Germany, you have to have the Seacat Air software that connects your cone beam machine and your digital impression unit so that those files can be sent to the lab. So there you have it. Digital appliances in an all-digital workflow, not just from your practice, but all the way to the lab. Now that kind of brings up a big question. When we say all-digital workflow, if the lab has their technology to do these appliances, the real question is, in your office, do you? Do you have a cone beam that takes a scan and maps the airway? Do you have a digital impression unit that will allow you to take both the upper and lower arch impressions and a buccal plate scan to see what protrusion that patient needs to be in? Technology by itself will not fix your sleep apnea program. It will not drive it forward. But technology in the hands of a skilled clinician and a calibrated team can be an incredible efficiency in the office. So if you're looking for efficiency and a workflow that makes sense both for your team and your patients, and you're looking to take it up a notch, consider what your technology might be able to do for you in this type of a workflow.